a dire warning from the medical expert formerly in charge of the U.S. government's effort to develop a coronavirus vaccine.
Without better planning, 2020 could be the darkest winter in modern history.
Immunologist Rick Bright told a House subcommittee he was removed from his position as head of the Biomedical Advanced Research and Development Authority after resisting pressure to expand access to an unproven malaria drug promoted by President Trump. Bright also testified that prior to the pandemic, his calls for the nation to increase its medical supply stockpile went ignored.
From that moment, I knew that we were going to have a crisis for our healthcare workers because we were not taking action. We were already behind the ball. That was our last window of opportunity to turn on that production to save the lives of those healthcare workers, and we didn't act.
Bright drafted a whistleblower complaint after his demotion. A government watchdog office says it found substantial likelihood of wrongdoing in Bright's removal. He's among several government scientists recently ousted from their positions after clashing with Trump over the coronavirus.
I watched him, and he looks like an angry, disgruntled employee who, frankly, according to some people, didn't do a very good job.
Trump discounted Bright's concerns about a second wave of infections and headed to Pennsylvania, where, without a mask, he toured a medical equipment distributor. As the economic pain from shuttered businesses continues to mount and the presidential election draws near, Trump says the U.S. should begin to reopen, a position championed by some protesters who are also his supporters. But polls show most Americans think it's too early to reopen.
I don't know. This is a very scary time, and I don't think it's over right now.
Even as lines for food giveaways snake on, and newly released unemployment numbers show 36.5 million Americans have lost their jobs to the crisis. Heidi Zhou-Castro, Al Jazeera, Silver Spring, Maryland.
Well, Dr. Julie Fisher is from Georgetown University. She says there needs to be more planning for the autumn months when the flu season begins.
I think what Dr. Bright did today was call attention to this next steps that absolutely have to happen to make sure that we are prepared to respond to COVID-19, not just now, but as we go into fall, when the situation becomes much more complex as we approach the typical flu season. I'm worried, I'm concerned what he pointed out about the lack of planning is something that we should be paying attention to and following through and not simply dismissing as a political concern. It's absolutely critical that we plan and prepare to respond going forward. This is why it's so important in any event like this, particularly a pandemic of this magnitude, that there is a public health expert with the technical expertise out front to help give good, solid advice and help both the public and decision makers understand what is effective and to avoid rumors or any treatment that might in the end be actually risky for their health. I am concerned that we don't always have the scientists and the technical experts up front giving clear and unambiguous messages about what we know, what we don't know, and what we are doing to close those gaps. In a situation like this, it's absolutely vital that the decision makers at every level, the federal level and the state and local levels, are relying on evidence based on the best information that we have from technical experts right now.